For more on the Mpox outbreak, let's go right to Dr. Jean Nashega. He's an associate professor in the Faculty of Epidemiology at the University of Pittsburgh. Thank you so much for joining us from Rockville, Maryland.
Thank you for having me.
Well, Doctor, I want to get your reaction to the latest news we're seeing, this virus crossing borders. How much of a concern should this be for the global community?
I think this should be very concerning, and we should take all the measures to prevent, to control this virus before it gets to the level of COVID. By controlling it, I mean we need to get the new cases to come down, and that will only happen through mass vaccination, as we did for the global outbreak of the clade 2B in 2022 in Europe and United States. Again, as I say, the world is becoming a small village. Nobody is safe until the endemic country where the virus has been for many decades is it's controlled.
What does close contact, when it comes to spreading Mpox, we've been hearing these cases of travelers, but we've also been seeing people of all ages really being affected, from babies to young children to adults. Is it a matter of, touching someone's hand or being within their perimeter? How exactly does it spread?
So historically, this was spread through exposure to contaminated animal in a wild, really deep forest. But the epidemiology has been evolving, and the new strain, which has been documented by our research group in Democratic Republic of the Congo, shows some mutation with a propensity of spread human to human through sex or just through contact. So there's been an evolving epidemiology, and that's why I explain from children to young adults, especially those who are sexually active, are getting more at risk. So there is high-risk groups, which is obviously children, healthcare workers who are exposed to patients who have Mpox, and obviously commercial sex, men who have sex with men, and pregnant women, because of all immunocompromise, including HIV, are at risk, which brings us to the issue of co-infection with HIV in continent like Africa. So this is really a ticking bomb. We need to do all we can to control it.
I want to ask you about the vaccines. We're hearing word of vaccines being sent to the African continent, some of the most affected countries. Is there any concern at all that there will not be enough vaccine? And do we know if any other companies are trying to make more vaccine?
So the vaccine stock is quite limited, and to try to ramp up the production, the Bavarian Nordic is going to take quite a couple of months until possibly next year before we get to the 10 million, which is really needed to control this in Democratic Republic of Congo. So this is really a problematic, but there have been some commitment to get there, but it will take some time.
All right, Dr. Jean Nashega, thank you so much for joining us. We appreciate all of that information. Thank you.
Thank you so much. Thanks for having me.